I'm Vanessa Mitchell with PMD Alliance, and today we are going to be talking about something I know all of us are very interested in, and that is going from exhausted to empowered, dealing with fatigue. And I'm excited to talk about this. We presented on fatigue before. If you have had the opportunity to watch it or going back to our video library, we had Dr. Joseph Friedman talk about fatigue in the past from the neurology perspective. And that is important, talking a little bit about why people with Parkinson's experience fatigue from the neurological perspective. Today, we are taking a practical approach to fatigue. And I'm excited about this because a lot of people feel disempowered when they have fatigue and feel like they're sort of at the mercy of that. And so we want to talk with you today about things that might be helpful to you and ways to combat this. So I'm excited to have with us Whitney Henderson. She is a doctorate in occupational therapy. She is the director of the post-professional education and associate clinical professor of the Department of Occupational Therapy at the University of Missouri, Columbia. She has a master's and a doctorate degree in physical therapy, occupational therapy. I'm off today. And I'm excited because I don't know how many of you have actually engaged with an occupational therapist before, but they're extraordinarily important. And I do not think that people really fully understand the benefit of an OT, and we want to give you a little bit of a taste of that. So I'm going to welcome Whitney to the program today, and I want to hand this over to you so that we can get started.
Awesome, great. Let me take a moment here and get all of the things shared. And then I think I just need to swap. Are we good to go?
Perfect.
Perfect. Awesome. Well, thank you for that introduction and thank you for inviting me to speak on this important topic. My goal for the presentation is to be pretty interactive, so please feel free to ask questions, drop them in the chat, raise hand, and I know that they are monitoring that as well. My second goal is that you can implement one or two of these strategies to help you fight the fatigue that you may be experiencing in your daily life. And maybe if the strategies aren't implementable yet, maybe just being more aware of your fatigue as well. So I've already sort of been introduced, so I'll just give another quick rundown here. So again, Whitney Henderson, and I am an occupational therapist. I currently work as associate clinical professor in the Department of Occupational Therapy at the University of Missouri. A vast majority of my clinical and research background is working with individuals that have various neurological conditions. So Parkinson's disease, stroke, concussion. I love all things neuro related. I also teach a wide variety of courses in our curriculum, mostly related to adults. And I always say I have one of the best jobs in the world because I get to teach a little, I get to research a little, and then I get to practice a little as well. I listed some of my accomplishments related to Parkinson's disease in case you had any further questions or needed any further resources, just to give me a little bit of credibility on the topic as well. So I recently just helped write the OT practice guidelines for people with Parkinson's disease and completed a systematic review, and we looked at all of the evidence for OT interventions for care partners of people with Parkinson's disease. I provided webinars for LSVT Global, completed several other presentations and research studies related to PD, and have also received 2 small grants to support our work in these areas. I just recently finished a really fun book chapter about how motor and cognitive interface impacts people with Parkinson's disease, particularly when they complete leisure activities. I placed my email at the bottom of the screen here, or the slide, I should say. If you'd like to connect in the future, please just put the title of the presentation in the subject line because I sometimes skim through emails pretty quickly. So here's our outline for this presentation. If while I'm going over this outline, if you don't have a paper and pencil or paper and pen handy, try to grab that because we have some activities that I want you to be able to sort of write out. So try to grab that now. Today, I hope that you understand the fatigue definition and the different types of fatigue. We will briefly discuss a wide variety of factors that may be contributing to your fatigue. I'll hit some of the boring things, the evidence things that aren't as fun. We'll do that quickly. The evidence for fatigue for people with Parkinson's disease. I want you to be able to assess the impact the fatigue has on your daily life. And then I think there are 7 strategies to help fight fatigue, and then hopefully creating an action plan for how you can implement one of those strategies into your daily life. So before we can address fatigue, we must understand it. So what is fatigue? So fatigue is the sensation of exhaustion that interferes with usual functioning. So that's the first key point I want you to realize, that the fatigue is interfering with your daily life. Fatigue is not always proportionate to the exertion or activity level. So that's the second key point. So what do I mean by that? Let's say you run a marathon. You would expect to be extremely fatigued or tired by that activity. That is normal. It's proportionate. However, let's say you unload the dishwasher. However, after you unload the dishwasher, you feel like you ran a marathon. That is not normal, as that is disproportionate. So those are kind of the 2 key points that really define fatigue. With those 2 key points in mind, that helps us understand that fatigue is different from tiredness. So majority of people feel tired at some point in their week or life, but it doesn't interfere with their daily life, and it's expected after certain types of activities or events. So for example, if I had a bad night of sleep, I can still go to work and do my responsibilities, and it's expected that I feel a tired sensation after my poor sleep. So that's how tired and fatigue are different. It's also important to note that fatigue can occur all of the time, which is continuously, as it's stated there on this slide, or some of the time, which is intermittently. Fatigue can also be really multidimensional, so it can be physical, mental, or emotional fatigue, and I'll discuss those on the next slide. And you may experience some of those at the same time or at different points throughout the day or your life. So here are some examples of the different types of fatigue. So let's break those down. And as you kind of listen to the definitions and examples, I want you to start thinking about activities in your daily life that maybe make you feel fatigued. So the most well-known and discussed in the literature is going to be physical fatigue. So when you feel physical fatigue, you may feel really low energy levels or just feel really sluggish. You may have challenges even starting an activity, getting the energy to even start it, or having the energy to sustain or complete that activity. So some examples of how physical fatigue may be present in your daily life could include when you are cleaning your home, when you're out doing yard work and working in your garden, or when you're engaging in various forms of physical activity. The next 2, sometimes mental and emotional fatigue, get lumped together into one big category, but I like to really separate these 2 out. So mental or cognitive fatigue is when your brain just feels really foggy or really tired. You might not be able to think clearly, or might have difficulty paying attention or remembering things, or even finding the right words. So activities that may make your brain feel really tired are just driving in busy traffic. So just all of the stimulation from noises and having to be on alert all of the time can make you feel really cognitively fatigued. Managing complex bills and medications may fatigue your brain a little bit, or even trying to coordinate many medical appointments or tests. Lastly is emotional fatigue. So you may experience emotional fatigue when dealing with prolonged periods of stress, or maybe when you're having to make difficult decisions or engaged in difficult situations. You may also experience emotional fatigue when you feel overwhelmed or disconnected. So that could be emotional fatigue from financial stress, making a caregiving decision, or even loss of a loved one. So those are the different types of fatigue that you may experience throughout your life. So this is where we get a little active and you start thinking about your own life. So I want you to take a moment and think about the activities that make you feel the most fatigued. So I want you to try to list at least 3 activities in your daily life that make you feel the most fatigued. Or if you're like, Whitney, there are a ton of activities that make me feel really fatigued. Maybe your top 3 activities. So write those down. If you want to drop that list in the chat just so we can see it, please feel free to also share it that way. And then as you write down those 3 activities, I want you to think about what activities are an effective use of your time, and then what activities are not an effective use of your time. And we'll save those responses for a little activity later. And I just want to note that the effective and ineffective use of your time activities is from a lifestyle redesign program out of USC. I want to make sure I give them credit as well. So again, give you a couple of moments just to jot that down. Good. I see some people dropping some things in the chat. Excellent. Good examples there. And again, you don't have to share, but please feel free to share. Look at my clock here. We'll go another minute to give you a meal making. Excellent examples so far. Perfect. Keep those papers handy or those thoughts handy, and we'll see if we can give some strategies throughout the presentation. I just wanted to also introduce a fatigue diary. If you're not quite sure what activities make you the most fatigued, or just want to develop maybe a better inventory of those fatiguing activities, this is a useful tool that I use in the clinics with my clients. So this is just kind of a snapshot of it. So over the course of the week, you write down different activities that you do and the time frame in which you complete them. So you can see right here, it says day of the week is Sunday. Activity is maybe you did 2 loads of laundry and you did that from 10 a.m. to 11:30 a.m. Then you can rate the amount of physical fatigue, cognitive fatigue, and emotional fatigue you felt during and after that activity with some comments as well. So there's a scale there. 1, mild fatigue. 4 is severe fatigue. So maybe that the task of doing 2 loads of laundry was 4, very physically fatiguing, but maybe 2, it was very cognitive or more mild cognitively fatiguing. So this just gives you kind of an inventory of what activities are making your fatigue worse and the type of fatigue that it's causing, so that you can maybe plan out or be aware of those activities a little more. And again, this can also be done in a simple notebook as well. So I do ask a lot of my clients to develop a fatigue diary so we know where we can implement some strategies.
Hey, Whitney, can
Yes.
we, for those who are not able to actually see some of the comments because they're maybe driving or something, can you call out a couple of ones that you think are good examples?
Absolutely. There are many good examples. So, organizing paperwork, driving, household household chores, drying hair, vacuuming, balancing a checkbook is exercise, showering, shopping. Lots of good examples here. Talking to insurance companies, I'm sure that is cognitively and emotionally fatiguing. So hitting on some of those other types of fatigue besides the physical fatigue, I think is important to note. All right, so what factors influence fatigue? Well, there are many, and typically it includes multiple factors. So, examples include a poor night's sleep, physical exertion, a busy day, emotions, temperature, particularly when overheated, medications can impact your fatigue, food, and hydration. So, this information is actually from a study with a little over 1,000 people that had Parkinson's disease. And the individuals in this study had been diagnosed with PD an average of 4.6 years. So I highlighted the top 5 that they think influenced their fatigue. So those are the blue ones. Um, it was interesting though, 12% of these individuals in the study could not identify the trigger for the fatigue. So you may not be able to identify what caused me to feel really fatigued while unloading the dishwasher. They did report that physical exercise makes them tired, but it was also a really good coping strategy, as I'm sure you all are very well aware of how important that activity is, physical activity in your life. So we'll talk about some of these throughout the presentation as well. I just wanted you to be aware that there are multiple factors that could be influencing your fatigue. So again, I don't want to bore you with the evidence surrounding fatigue management, but there is a lot of support for managing your fatigue and the strategies that I will talk about today. So there are many more, but these are 3 really recent studies, and they are well done by these researchers. So in the first study, the feasibility of a treatment protocol for Parkinson's fatigue management using a cognitive behavioral approach, This was a 12-week program in which participants met once a week for 6 of those 12 weeks. The sessions focused on education on multimodal physical exercise, barriers to physical activity, sleep hygiene, stress management principles, and utilization of social support. So at the halfway mark, 40% of the participants had a significant difference in their own life with their fatigue. And so again, that was just at the halfway point. They're still kind of collecting data for that long-term outcome as well. In the second study, the authors in the co-design article reviewed quantitative and qualitative studies. So they used a ton of evidence to develop their fatigue management program for people with Parkinson's disease. And they also explored a ton of self-management theories as well. After that, they actually worked with people who had Parkinson's disease, their care partners, and a variety of healthcare and community professionals, and they co-designed, so worked with those individuals to design an online course. They did further refinement and online development to create the Live Well with Parkinson's Toolkit, and that's an online program. They implemented several rounds, got feedback, and refined it. And it has 15 different components to help people manage their fatigue. So, support with physical exercise, access to good quality aids, adaptation and monitoring devices, and then peer and social support are just some examples of what was in that toolkit. The toolkit has undergone feasibility testing with really good results and is currently undergoing a rigorous randomized controlled trial in the United Kingdom. And I think that the United Kingdom puts out a lot of really great literature for individuals with Parkinson's disease. I use their literature a lot when working with individuals with Parkinson's disease. And then this last study, again, fatigue management, just trying to show that there's good support for managing your fatigue. They implemented a managing fatigue individual program, which consisted of 6 weekly sessions, one-on-one via an online platform for people with Parkinson's disease. And so this program was already really well researched with individuals that had multiple sclerosis, another neurodegenerative disease. And so now looking at how well does it work with people with Parkinson's disease. Topics again are rest and sleep, body mechanics, communication, priorities, balancing your schedule, and so on. A lot of what we'll talk about today. And the outcomes included individuals experienced increased participation and satisfaction with their daily task. They had better or less reported fatigue, better occupational balance, better sleep quality, and better self-efficacy. So again, this is kind of on that next phase, a really big, larger trial as well. All right, so now that we've got through some definitions and some evidence, hopefully you understand what fatigue is and how it may be impacting the activities in your daily life. So let's walk through some strategies for helping to manage your fatigue. So before we dive into the first strategy, we're going to do kind of 2 activities so that you can implement a couple of the strategies a little bit better. So on your paper that you hopefully have, draw a big circle for me like what's on this screen. And I want you to think about your day. And there's 6 categories in the boxes at the bottom of the slide. So there's work, there's rest, home activities, which are probably cleaning, cooking, laundry. Self-care are things like dressing, bathing, eating, leisure activities, and then some other category or some other activities that maybe don't fit cleanly into that category. So divide your circle into a pie. If you spend a lot of your day in leisure activities, it should take up a bigger piece of your pie. And you can kind of see that example over to the side. So I'm going to give you some time to do that. So it's always nice to see a visual of how you think you spend your day. And again, if you want to drop some information in the chat, maybe about where you spend the biggest piece of your day or what activities you spend the smallest piece of your day, feel free to also do that. Lots of people are writing. Excellent. Give another minute or so here. Yes, include sleep. Put that in rest. So someone asked, should we include sleep? And yes, I would put that in rest category. You can put artwork in leisure would be a good way to put that. Yeah, maybe leisure. Thank you. Great minds. Mhm. Good questions. Socializing and meetings, I would probably put in leisure as well. Exercise, I think, could be self care. That's a good one too. Or if you find that more of a leisure activity, you could also, that one could go either way as well. Depending on how you use leisure. Own category for X, that works too. So as you're kind of wrapping up your circle, now I want you to just look at it and think about, is that how you want to spend your day? So do some activities take up a way bigger piece of the pie than you would like? And are there some categories that are taking up too small of the pie? And so just reflect on that for a moment, and that might be a place where we can apply some of these strategies. So again, is that how you want to spend? Some things are taking up too much and some things are not taking enough of the pie. Give you a minute to finish up that and then we'll talk about some activities. I would actually put errands in home activities. Even though you're out and about, that's probably a lot of home activities. Great. Someone posted, I changed the way I divide my time and so much improved. Excellent. All right, keep that close because we're going to see if we can rearrange your time at all. But before we start to prioritize and plan your time, I want you to start thinking about what of my activities are high demand and what of my activities are low demand. So let's analyze some activities. So I want you to think about the purple activities in the center. Would you say they are high or low energy and effort? So I'm going to state the activity and give me a thumbs up if you think it's high demand, or a thumbs down if you think it's low demand. So that first one here, doing laundry. High or low demand task, typically. Thumbs up for high, thumbs down for low. Perfect. I see some thumbs up. I would rate that a high. So that would be a high demand activity when we're talking about your energy and fatigue levels. What about yard work? High or low demand? Thumbs up or thumbs down? We'll put that one in high demand as well. High demand there. Using a computer, thinking about your energy and effort, high or low demand? High is up, low is down. Perfect. We typically put that in a low demand. Excellent. Exercising, high demand activity or low demand? Perfect. See some thumbs up. High demand. Watching TV, high or low demand? You got it, low demand. Thumbs down on that one. Gardening, working out in the garden, high or low demand? You got it, high demand. Thumbs up on that one. And last two, reading, and I'll lump these together because they're the same. Eating, high and low demand. That just the actual task of eating, not cooking of itself. Perfect. We've got low demand. So now you've kind of got your activities. You kind of understand what low and high demand is. Let's start planning some things out here. So strategy number one is to prioritize and plan. So again, now that you know how you spend your day and the different types of high and low demand activities, we can start strategy one of prioritizing and planning your week. So we recommend that you space out the high demand tasks throughout the week. So for example, if you have 3 high demand activities that you know you need to do this week, you might do one on Monday, one on Wednesday, and one on Friday versus doing those activities on back-to-back days. For example, if you know you're going to the zoo with your grandchildren on Friday, but Friday is when you usually clean your bathroom, you might consider moving that cleaning task to Wednesday. So again, spacing out those high demand activities and planning out that week. If you cannot space out your high demand activities, it's unavoidable throughout the week, then try not to do 2 in one day. So maybe you can go Monday, Tuesday, but trying not to do 2 really high demanding activities on the same day. If you have to do them on the same day, pair it with a low demand task. So it's best if you don't do 2 high demand activities back to back either. Put a low demand task in between just to give your body, mind, and emotional state some rest. You can also prioritize a little bit, so prioritize and planning go together. For example, if there are 2 things you need to get done today or this week, but you have these 3 other things that are just bonus if you have the energy to do them. So maybe just starting with the 2 biggest ones, and then again feeling out the day and the week and seeing if you can fit in those other 3 maybe I have to do activities. You may also start to think about when are your most fatiguing times of the day and avoid activities that can't be stopped during those fatiguing times. So, for example, grocery shopping is a task that you can't really stop. You kind of got to get through it, kind of get into the store, get up and down the aisles, get checked out, and get back to your car. Therefore, if you're really fatigued in the afternoon, try to plan your day or your week so that you can do that grocery shopping in the morning when you have more energy. Then be sure to plan a low demand activity right after that. So even think about too, like if you get home, so you get home from the grocery store, which maybe is a high demand task, maybe just thinking about bringing in the cold items first and then just taking some period of rest and then going back out into the car later in the day to really unload the items that would be fine to sit in the car. So kind of prioritizing and planning out that day and that activity. Again, if you continue to push through an activity that can't be stopped, it becomes too fatiguing or stressful. It may cause more pain or fatigue for the next several days, and it may even place you at risk of injury or safety concerns. So I want you to think back to your answer to the question about activities that are not effective use of your time. Can any of those activities be eliminated? Are there any other activities throughout your day or week that can be eliminated? So again, let's stick with that grocery shopping example. Can it be eliminated or slightly turned down a little bit if you do online shopping or grocery pickup? Is there someone else that could help you complete that task if you have too many high demand activities in the week? Lastly, not only do you want to plan out your day and week, but you may want to plan out the activities. So I want you to make sure you allow yourself enough time to complete the activity so that you don't have to rush. And then secondly, plan out that task. So let's go back to the zoo or your kind of our grocery store example that I'm using on this slide. You could potentially look at a zoo map and understand the best places to sit, where you could take a break for 5 minutes, or even look at the best places to park so that you can reserve some energy by planning out that task. For the grocery store task, you may also make a list by the aisle so that you aren't wasting energy going from one side to the store to the other side of the store to find your items, and you can efficiently and effectively get through the store. So again, here is an example. I like to sit down with individuals and kind of work through what their week looks like. We kind of list out all of the activities you have to do this week. And then we start thinking about, is that a high demand and low demand? And what do you have going on? And where can we start to pencil some things in? So even if paper calendar or piece of paper to do this at the start of every week can really help you kind of set your week up for success and help you manage your fatigue a little bit better. Strategy number 2 is about pacing. And so it goes along with prioritizing and planning a little bit as well. So not only do we want you to balance high and low demand activities, but we want you to build in periods of rest. So we want you to be proactive with your rest. Take frequent short breaks. For example, for every hour, maybe pause and rest for 5 to 10 minutes. We also want you to rest before you reach the point of exhaustion or the point of fatigue. Do not wait until it is too late. Timers on your phone or little buzzers on your watches are great ways to set reminders to rest. You can even incorporate some really good deep breathing while you're taking those periods of rest to really kind of refuel the lungs and refuel your body. I'll have to do some searches, but I know there are some really great apps that kind of allow you to remind you to rest and kind of allow you to check in with how you're feeling and make you really more aware of how you feel during those rest periods. One big area to pace and incorporate rest is in your exercise routine. So, again, exercise is medicine for many of you. And so, figuring out how you can exercise while also not kind of exacerbating your fatigue. So, again, that short period of rest is really beneficial throughout your workout. So, setting those timers, setting those reminders, maybe doing a couple of exercises and resting, or planning a really low demand activity after you rest. There's one more really great way to think about pacing, prioritizing, and planning, and that is the spoon theory. So remember, you only get a certain number of spoons each day. So for example, let's say you get 10 spoons for the day, and that represents the energy that you have to complete your task. If your boxing task takes 6 of those 10 spoons, you really only have about 4 spoons of energy left for the day. Therefore, you may need to pace throughout that activity and throughout the day and learn to really plan out and pair your activities with some lighter activities that only require 1 or 2 spoons. And I've got some examples of this on the next slide. And as you're kind of thinking about this and hearing me talk about that, you might even write like the number of spoons you think your activities take a day. So I know you all listed some of your activities and you kind of balanced your day or looked at your day, kind of thinking about which of those activities require a lot of my spoons and which of those activities don't require very many of those spoons. So here's a great example. So in this picture, this individual has 12 spoons or 12, a full battery or a full tank. 12 spoons is what is full for the day. They've rated each of the activities that require 1, 2, 3, 4, or 5 spoons. And therefore, if they go out with friends, that takes 5 of their spoons. And they likely wouldn't want to clean their house in the same day because that also takes 5 spoons. And they're only really working with 2 spoons for the rest of the day. Therefore, they may shower in the morning, which is 2 spoons, rest, drive locally, which is 3 spoons, rest, and then go out with friends, which is at 5 spoons before taking their medication. So, again, kind of balancing out and thinking about your activities in terms of spoons. How many spoons do you feel like you have a day? And where can you put activities and balance activities so that you use your spoons effectively? And then also thinking about the higher spooned activities. So maybe there's an activity that requires 4 or 5 spoons. Thinking about where you can pace and where you can take a break. So that 5 spoon activity maybe only feels like a 4 spoon activity. So again, a great way to think about your activities to really help you plan out your week, to plan out your day, to figure out where you need to rest and pace yourself. All right, so strategy 3 is conserving and modifying your energy. So, back to the spoon theory, I want you to think about how you can make your activities go from, say, a 5 spoon activity to a 3 spoon activity by modifying it. You might ask yourself, how can I make this easier? Or how can I reduce the effort? I'm going to go through a lot of examples here. This is by no means exhaustive. There are many, many, many ways that you can reduce the effort and energy required of an activity. It just depends on what your activities are. Hopefully, though, if I give you some ideas, that will start to spark like how you can change your activities. So first strategy here for conserving and modifying is to divide the big task into smaller parts. So if you're cooking a big meal or a dessert for dinner, you might chop your vegetables or make your dough in the morning. You might make your dressing or your icing midday, and then you can do that final cooking or icing the cookies at night. So again, thinking about what's this big task and how can I turn it into many small tasks to plan throughout my day. You also want to avoid big or heavy loads. Those are pretty physically fatiguing. So you might use a small cart to push items around your house. You can use a laundry basket that has wheels to carry your laundry. I've had clients also just use those laundry baskets to carry items around their house. Maybe it wasn't even laundry, and so on. You could even space out your trips so that your loads are smaller as well. So planning out, maybe you need to make 3 trips back to the bedroom. How can you maybe carry some smaller items and space out those trips to the bedroom? We also want you to arrange your spaces so that the items you use most are near you. They're put in places where you can access them the most frequently. So, for example, placing your towels closer to the shower or the pots and pans that you use really frequently in easy accessible places in your kitchen. You may take things that you don't use as much and store them kind of out of sight and only kind of bring them to the space when you need them. So again, frequently used items stay really close to you and they stay in the spaces that you use the most often. If you have stairs, trying to reduce the number of trips you take up and down those stairs by planning what you need to take up and down the stairs, or perhaps just moving items that need to stay on the first level or that need to go to the basement to those spaces so you're not constantly going up and down. Sometimes we'll recommend using prepared foods on hard days, so keeping just kind of a stash of some simple microwave meals or store-bought meals for when you don't have a lot of spoons left to cook. Next one is using a stool to rest, and you can see that picture of the individual on the side of the screen. So for example, in the kitchen and the bathroom. So think about what activities you could just do in sitting. So by sitting during a task, you can reduce the energy demands by up to 25%. So if you um, stand to fold your laundry, could you sit on the edge of your bed or on the couch to fold your laundry? If you stand up to dry your body and that takes a lot of energy, could you sit on a toilet or a shower chair to dry your body? Could you sit on a sturdy stool and vacuum a small space versus walking all around the room? So again, just some examples of how you could sit and still complete a daily activity that's important to you. The last two are just some other simple strategies. So sliding items rather than lifting them. So if you have a big counter space, lifting heavy objects can be hard on joints and can be really fatiguing. So can you push them along the counter? And then maybe perhaps using a rope to do that initial dry off versus a lot of towels and getting the entire body. So again, just some examples that may have sparked some ideas about some examples in your own life. All right, strategy 4, hopefully everyone's doing well, hanging in there, is delegating. So again, I want you to think about the tasks that were not an effective use of your time and which tasks are really fatiguing. So you talked about those a little bit at the beginning of the presentation. Can you ask anyone else to do those activities? Could anyone else help with part of the activity? And I also want people to understand that it's really okay to say no. So before committing to a new activity, think about how that fits into your day, your week, your life in terms of managing your fatigue. And so I think saying no or delegating, I don't want you to mean that you aren't capable. It just means you're being smarter with your energy. It doesn't mean you can't do it. You're just working smarter. I like to give an example. I had a client a few years ago who was really cognitively fatigued by checking emails daily for the support group. She was the communication coordinator for the support group, and that was an extremely fatiguing task that she started her day with. And so after a few sessions of working together, she was able to delegate a task for the other to another individual for 2 days a week. And so she would check emails Monday, Wednesday, Friday. Someone else would check emails Tuesday, Thursday, and it made a huge difference in her cognitive fatigue. I think she was really fearful about letting go of the task. And so finding that balance of having someone else help with it was a really good medium to help her manage that cognitive fatigue while also allowing someone else to help with that task. Sometimes we'll teach the use of I statements. So when asking for assistance in a delegating task, I always encourage the use of I statements. So again, thinking about like, you never help me when you're asking to delegate, but just saying things like, I need help, I'm really fatigued today, and taking that you out of it and putting that I in it. Strategy 5, positioning. So there are two key points to positioning here. First, we want you to avoid staying in a position for too long. So if you stay in a position for too long, it can lead to a lot of joint stiffness and muscle fatigue. So for example, if you sit at a desk or a table a lot, set a timer to change positions about every 20 minutes. Or if you're doing something at a table and there's a TV nearby and you can kind of hear those commercials, change your position every time there is a commercial, or get up and move around just a smidgen every time you hear that commercial. We also want to ensure correct posture, which is a really nice upright posture, which I know a lot of individuals find that hard to maintain that upright posture. We kind of live in a world where we slouch a lot. So again, not only is this good for your joints and muscles, but it really helps you get that oxygen intake for your lungs to help your body just work better. You can kind of see the different examples of bad positioning on the side of that screen. And again, that individual kind of at the top right is taller, and so kind of leaning over the counter. So if that is you, and of course it's not easy to raise the countertops, you might think about an elevated surface. So can you set it up on a book if you're going to be in that position for a while, or a small tray so that you're standing upright a little bit better, not slouched over your counter, or perhaps even sitting there may make it you on a more level surface with the activity that you're doing. You can see poor posture at kind of at a desk. And so again, encouraging that nice upright posture if you're working on that computer. And then in the car is sometimes where we see kind of a poor posture as well that can impact your fatigue. And so I will put a little plug in here for CarFit if you have not heard of it. It's an organization kind of around the United States that assesses the fit of the car. So they don't do any like driving assessment at all, but they often host a drive-through event where you just kind of like pull in and then they look and see how well the car is fitted to you. So making sure your mirrors are adjusted well. And sometimes when our mirrors are adjusted well, that promotes that nice upright posture versus having to like lean down and see them. Or if we just adjust the mirror up a little bit, that promotes a nice upright posture if you spend a lot of time in your car. So again, if you can find a CarFit event near you and you're a driver, I highly encourage that. Just a really nice, usually community event that's free of charge, just to make sure that you're in a good position while you're driving. I'm going to pop in on the chat. Usually they will, I would assume.
There was a question that came in earlier. They wanted to know, are you saying that demand is correlated with fatigue?
Yes. Yeah, if it's a high demand, that's a high energy, high effort activity that is likely to cause fatigue, whereas low demand is maybe offers a little bit more period of rest and recovery.
So the person who's saying they're not seeing the figures at the bottom of the screen, they're at the bottom of the slide. I don't know if you need to expand the slide or if Kelly has any recommendations for the text side of making it more visible to you. But there are little figures at the bottom sitting in a car seat and on a computer.
They're not, the one in the computer is not super bright, so that one probably
Yeah.
is a little harder to see. All right, a couple of strategies left for you here. And so, of course, sleep is important for fatigue. So, strategy 6 is about sleep hygiene. And I could do an entire big presentation on sleep. So, I'm just going to put some basic sleep recommendations on this slide, but do know there is much more to sleep hygiene. So, first, you want to develop a good sleep routine that helps you relax and get ready for bed. So, again, your sleep routine needs to be relaxing, not activities that kind of turn up your brain or your physical activity. Think relaxing here. This could be brushing your teeth, undressing, reading, meditating, deep breathing, body scanning, journaling. Again, those kind of quiet activities to help your body know that it's time to kind of turn down. You will want to establish a consistent sleep and wake time. So, for example, again, going to bed every night at 9 o'clock, waking up every day at 6 o'clock. Always recommend turning off your electronics 1 hour before bed. And the reason behind that is the light of the electronics actually reduces the production of melatonin in your body, and melatonin is what helps you sleep. So when we have light on or light from electronics, our melatonin can't release in order to help fall asleep. Of course, limiting caffeine 3.5 to 5 hours before bedtime, avoiding any heavy meals 2 hours before bed, and then also limiting the use of alcohol, as it can certainly impact your sleep. So that's a little bit about preparing yourself. Also want you to think about the environment that you sleep in. So your sleep environment really matters too. So I try to teach people that your body needs to know that you sleep in bed. So we say only sleep and sexual activity in bed. Avoid electronics in bed, paying your bills, maybe get on your computer to work. For my students, I have to tell them no homework in bed, even though it's comfortable. Because again, we want your body to know I'm in bed and it's time for sleep. We also encourage you to have your room like a dark, cool cave. So adding a really good curtain could be a benefit to kind of block out that light. You'll want a quiet environment or white noise for best sleep is what is recommended in the evidence. And then lastly, avoiding distractions during your sleep. And this one is extremely hard for me because I have two dogs that sleep for me, so I can't speak well to this one. But if you have animals in bed with you that frequently wake you up and you're identifying that you're up 2 and 3 times a night because of that, perhaps moving them to the floor or even outside of the room. I think sometimes phones can be distracting, so putting on a do not disturb. And if you're concerned about maybe getting an emergent phone call, there's settings on your phone that if that a phone call comes from a certain individual, it will go through that do not disturb setting. So again, trying to limit those distractions that may be waking you up throughout the night. So to nap or not nap remains slightly controversial topic, as some resources will say to do it and some resources will say not to do it. So I've reviewed some research that does support the use of a nap in the afternoon to prevent early evening fatigue for people with Parkinson's disease. However, there's some rules around the nap in order for it to be the most effective. So first we want you to remember, kind of what I said on that last slide, is that we want your body to remember that your bed is the place where you sleep. We don't want you to think that that's the couch or the chair and that when you're in bed, I'm here and it's time to sleep, it's time to rest. So therefore, if you choose to nap in the afternoon, try to do that in your bed and not in the couch or chair, because sleeping is the activity that occurs in bed and that's what your body knows and understands. Secondly, try to set a timer because you don't really want that nap to be longer than 40 minutes, so kind of a short power nap. And then lastly, if you are going to nap, it really does need to be a part of your daily routine. Otherwise, we don't see as much benefit. So just not napping like on a Wednesday, but if you feel like you do need just like a quick nap, building that in throughout the week and making that kind of an everyday routine. So not like Wednesday, but then Thursday and Friday of next week and Monday and Tuesday of the following week. It really should be a part of your routine to get the most rest and kind of recovery out of that afternoon nap. All right, and I believe this might be the last strategy. Strategy 7, cognitive and emotional fatigue. So as we discussed earlier, there are certainly activities and situations that cause kind of that cognitive or that mental emotional fatigue. And you all identified some of those in the chat. Some of those appear to be a little bit more cognitively or emotionally fatiguing. So we can address those types of fatigue just as much as the physical fatigue. So there's some similar strategies to think about here. So again, just kind of have a quick list to hopefully give you some ideas. So how can we reduce the cognitive load or stress? So thinking about the spoon theory again, if we think of our cognition as 10 spoons, how can we reduce some of those highly cognitive tasks to less spoons? For cognition, you can make lists or again, taking those brain breaks as well. So setting timers, using lists in your phone. I still like a good old paper and pencil list. So writing out lists so that that helps you kind of unload the task, the remembering portion of the task. You will also want to limit distractions. So doing anything challenging or complicated task in a quiet space. Try to turn off that TV or radio or music if you're doing that really cognitively demanding task, and perhaps even doing that task in a room where other individuals aren't in that space. You can plan out your day just like you did with the kind of the physical activities, and maybe attending to activities that occur at less busy times. So perhaps driving, grocery shopping at less busy times to avoid some of that cognitive fatigue that goes on with those tasks. The example I always give here is Target is extremely cognitively overwhelming and demanding on Saturday mornings, but it's not as bad on Wednesday afternoons. So maybe thinking about where can I put that task that doesn't require as much attention and remembering and concentration throughout my week. If you need to do a really demanding cognitive task, try to focus only on the cognitive piece of that task. So if you're kind of up and moving around while you're doing that cognitive task, something's got to give. More energy is going to go to the motor piece, or it's going to go to the cognitive piece. So if you need more energy to the cognitive component of that task, try to reduce the motor component. Sit down to do it, and not be up moving around quite a bit. Stress management is also really big for the emotional fatigue that you might feel. So again, I could probably do an entire talk on this, but I think I'll give you a few ideas. I think what is most important is that you find a strategy that works best for you. Everyone will be different here. So here are some different ideas. Again, it's well documented that physical activity helps with stress management. So figuring out how you can make that less fatiguing using some of the other strategies can certainly help with the emotional and mental well-being. Social activities such as friends, families, support groups, exercise groups, church groups are other great ways to manage stress. So just being around people that support you and encourage you and that help you. There are many coping strategies as well. So again, prayer, body scans, meditation, deep breathing, journaling, mental imagery. Many people like podcasts that uplift them as well. So again, finding one that really fits with your life. And then, of course, just being aware of what causes your stress. So, what is causing your stress? Where is it causing your stress? And how can you reduce that? So, is it maybe avoiding a stressful activity or event or someone that causes you a lot of stress? You can also use some logs to help manage your stress as well, just so you can see what is causing my stress and what is overwhelming. And then you can start to think about how you might reduce those. All right, so it is time. I hope that you have learned several ways to help fight or manage your fatigue. And my goal for you is that you can maybe at least implement one strategy this week or next week that maybe helps you manage your fatigue. And so, again, thinking about fatigue is a really big problem. How can you kind of tackle it one strategy or one action plan at a time? So, I want you to try to make an action plan for yourself for this week or even for next week. I want you to pick kind of one thing from the presentation and that you want to try to work on or do in the upcoming week. And kind of some key points of this, it should be something you think you can reasonably do. So again, I love big pie in the sky, like ideas and dreams, but we also want it to be reasonable so that you can achieve that and be successful in managing your fatigue. And then also we want it to be measurable in some way. So for example, you might say, I'm going to set a 20-minute timer to remind me to rest when I clean my house. You're going to plan out 2 days of your week. You're going to sit on a stool 3 days a week while you cook. You're going to log your sleep 5 days a week. So again, trying to think about what's my goal and how do I know if I met my goals. I'm going to give you a minute to do that. And if you want to put any ideas that you think you might try in the chat, also please do that as well. I'll give you a minute to think about that.
Whitney, in the meantime,
Yes,
um, I'll just make a couple of comments that came
sure.
through. So one was managing cognitive load is a big deal and helps so much with basic functioning. And then the other one I think is more of around just coping with and accepting the fact that people who have a chronic disease that they're dealing with, that they actually have to go to the point of spending time mapping out something like going to the grocery store or walking the dog, and how to juggle all of these things, when before they were able to just do them normally whenever they wanted, and just coming to terms with that. I don't know if you can speak to that at all, but there's definitely the emotional experience of coping with that, and that can be exhausting too.
Yeah,
I mean, it kind
for
of
sure.
adds to that emotional fatigue of just dealing with that.
Yeah. I can't speak to that feeling, of itself, but I hope that with implementation of a few strategies, that feels like less daunting of a task to plan out the week, that it becomes a little bit more routine in nature. Um, and that perhaps implementing like one or two strategies maybe helps. Like if you implement one or two here, it carries over to some other things as well, so that it doesn't feel like such a daunting task would be my goal. But again, can't speak to that as well. Um, the last part of developing an action plan, as I kind of wrap up, and then I will open it up for more questions too, is I want you to be confident and successful. So I want you to look at your goal for yourself for the next week about managing your fatigue. And one, or like, let's do zero. Zero, like not at all. I cannot achieve that goal. Or 10, like I'm pretty sure I can achieve that goal that I set for myself. Or I'm pretty sure I can try this next week. So if it's not a 7 or higher, I want you to revisit it and rewrite it in a way, or maybe reduce the complexity of it so that you can achieve it next week. So again, 7 or higher, I want you to feel confident that you can implement that strategy next week. And again, that's kind of how I end every session when we're talking about fatigue management. Like, what's the goal for this week? 7 or higher. If not, let's revisit your action plan and let's kind of target something else, because you feel confident that you can do it, and then start to see some changes, hopefully with your fatigue and managing that fatigue. As you're kind of wrapping that up, again, a little longer than I thought it was going to be, because I have lots of talking points, more than I thought.
Well, they
And
were
you guys
very
did a great job
important talking
interacting.
points.
Yes, you guys did a great job interacting as well. So it was great to see some of the examples in your own life. So yes, if you can stay on, I'm happy to answer any questions, or we can wrap up any way y'all need to.
Well,
The next slide as well as references if you need any of those references.
sure. I mean, I know people are very interested in this conversation and maybe would like to see some of the references. If you want to go ahead and
Yep,
share that
absolutely.
screen, I know people like to go back and do some of their own reading. So we'll give everyone a minute to look at that screen and see if there's any other questions that come in. But I appreciate you covering this. And I know that it is sort of daunting or almost exhausting thinking about making a plan. But I think once someone gets into the routine of it, they don't have to necessarily always write it down. They probably can do it in their head, and it's just kind of relearning or learning a task that's new or developing a new habit. It takes a bit of practice, would you say? But then later on, the benefit that they get from knowing how to divide their time up, or using that analogy of the spoons, like how I'm using my spoons, can really be beneficial. And I will say, Sarah just wrote, this was fantastic. It means a lot to have the reality of fatigue recognized so we don't feel badly about ourselves because of it. Absolutely. Thank you so much, Whitney, for covering this. We do have, if you all would be interested in giving us some feedback, one of the things we want to know is whether we're providing you information that is beneficial. I personally learned a lot from today's program, but we want to ask if you would participate in a quick poll so that we can get some feedback on, did you learn something new today? And are you going to change some of your behaviors? And I think she gave us some practical things to do that can be beneficial in us maybe changing our behavior. So I'll give you a second to do that, and then keep my eye out also for the poll or for the questions that might come in.
And I think too, kind of, I was looking at some comments and then just kind of speaking to what you said again, like giving yourself some grace and some time to make some changes. It's not easy, and so recognizing that baby steps can lead to some big changes as well.
Absolutely. And yes, there is a recording of this program that will be put up on our website with our YouTube channel that you can replay and go back and review this. And I know someone asked before and it was dropped in the chat, but the slides will be available. So you can go back and review those also, especially some of the activities. I think the activities were great. And so you might want to kind of do that. And maybe after today, you'll go back and redo your pie and maybe change how that looks. Awesome. Give one more minute, or not a minute, a couple of 10 seconds, and I'm going to close the poll if anybody still wants to add any more input. And thank you for dropping that in the chat, Kelly. There is the link, everyone, to our video library where you will find this recording, the one we mentioned earlier from Dr. Friedman, who covered fatigue from a neurologist perspective, and of course, all of our other programs that we have that you can access. All right, I'm going to close this poll, and I am going to assume there's really no other questions coming in, and I'm going to stop sharing your screen for a minute because I want everyone to be able to see each other, because I want to thank you so much, Whitney. We have a tradition at PMD Alliance. Usually when someone gives a great presentation, you get, clapping, maybe a standing ovation. Since that's a little hard to do online or noisy, we do the wave of gratitude. So I'm going to invite everybody to give you the wave of gratitude, thanking you for this incredible presentation and very practical tips.
Thank you very much for listening and participating and inviting me. It was wonderful.
Awesome. And thank you everyone for participating in the poll, and we look forward to seeing you at the next program. Take care, everyone.